Hi, I'm Toya Brasky from Galveston, Texas. Today I want to talk to you about having a uterine biopsy. This was my first experience ever to have it. A little history here is I have not been sexually active for 17 years, since 2008, just by choice. And I am also postmenopausal. My period stopped when I was 35. I'm now 61. So, a couple of weeks ago, I requested that my primary care doctor do a pelvis and transvaginal ultrasound because I've been having vaginal bleeding, and I just felt like something was not right in my vagina. And at first she turned me down. She said, that's not my field. I'm primary care, not gynecology. But I told her that I had so much anxiety that I feel that something is wrong, that I begged her to do it. So she did. The findings were that I had thickened endometrium. The lining of my uterus is too thick. She explained to me that in a normal postmenopausal woman, it shouldn't be greater than 4 millimeters. Mine is 9 millimeters. That could explain some of my vaginal bleeding. It's also very abnormal. So I was thinking today I was just going to have a normal pap smear and breast exam. But when I got to the doctor's office after the findings of my transvaginal ultrasound, they said immediately we want to do a uterine biopsy. Now, I wasn't prepared. I had no idea what was going to happen in this procedure. So I signed consent forms. She explained to me that she was going to have to dilate my cervix. I've never been pregnant. I've never had anything like that done. So I was surprised. She said, you're going to have cramping. You're going to feel cramping. And then she said, I'm going to have to put this pipette through your cervix, which is a pinhole opening. And then there's 2 doors to get into your uterus. So I'm going to have to push to get through the first opening. And then I'm going to push even harder to get through the second opening. And then once I get in there, I will pinch out tissues. You are going to feel cramping. I want you to take a deep breath and hold it. So as soon as she dilated my cervix, I felt immediate cramping starting. And it is a very strong cramping. It's a cramping like I've never had before in my life. When she started to push through the cervix, you feel a lot of pressure. And then that wasn't the worst part of it. She said, I've got to get through the second door of that. When she pushed through the second door and she did get into the uterus, immediately the uterus just reacts in a violent way. I began to have contractions of my uterus. She kept saying, hold your breath. The cramping is going to be pretty bad, but it's not going to be long. I'm going to get the tissue that I need. So she proceeded to get the tissue with a pipette and then put it on the sample glass. And then she stopped for a minute and she said, you know what? I want to get your permission to go in a second time. Let's make sure that we get enough tissue, because I don't want to call you back for another biopsy. I would rather get enough tissue today to be sure that the pathologist can get the right amount of tissue to diagnose you. So as much as I was cramping and it was so painful, I said, yes, go ahead. Let's just get this over with. She went in a second time. The cramping was even more. She got more tissue. And then she explained, I'm going to finish the procedure. There are some risks. There's risk like You could get infection from this. You could have prolonged bleeding. You're going to have cramping even after you leave this appointment. I think that doctors can make this better for women. I think that you could use topical anesthetic. I think that you could give something to relax the uterus so that the uterus isn't contracting so strongly. I think that that would make them such a difference in the procedure for women, and I don't know why it's not done. As for the staff, I had the most wonderful staff today. They explained everything that I was going through. I'm glad for that. They said that it would be 5 to 7 days before my biopsy returns. I'm really going through a lot right now. I'm having breast biopsies for multiple masses and also the biopsy of my uterus all in the same month. So all I can do is just wait for results and then deal with whatever the news is after that. I just wanted to let you know so that you know what the procedure is like. I've never been pregnant. I've never had any type of procedure like this. So for a first-time person having a uterine biopsy, I'm not going to lie to you. It's very uncomfortable. It is painful. You can tolerate it, but you shouldn't have to tolerate it. I think that the medical profession can do better than that. So anyway, I hope that my story helps somebody. Thank you for listening. Bye.